Hi, everyone. I'm Eric Christensen, pharmacist, board certified in pharmacotherapy and geriatrics. And I've been preparing study materials, helping people pass these exams since about 2014, 2015 with various content. So we've gone through lots of content outline changes and changes in the exam over time. And I just want to update you and prepare you for 2022 if you're looking to take the exam in the spring or the fall of 2022 coming up here. So, with that said, let's get into the content. As you can see, second from the bottom there, the BCPS or the Pharmacotherapy Exam is one of the most popular. In my opinion, it's one of the most diverse. So if you're applying to different jobs, whether it's ambulatory care or oncology or anything like that, in my opinion, it is the most diverse and I think probably the most well respected. With that said, you may base your decision upon what you want to do in your practice. If you want to go ambulatory care and specifically work there, you're probably going to pursue BCACP. With that said, if you're not sure where you want to end up working in your career, but you want to get board certified because it's kind of a little bit of a protection as far as your career goes and availability to apply to different jobs, BCPS is the way to go if you're not sure on what path you want to do, at least in my opinion. So with that said, it is a very difficult exam, and probably the biggest thing that makes it challenging is it's so broad. It covers so many different topic areas, and it's challenging. It's very, very difficult to know the guidelines, contraindications, all this sort of stuff with this exam. So only 62% passed. This is from the fall of 2021. Recertification numbers are a little bit better, of course, 73%, because a lot of those folks have passed it the first time and they have kind of experience with the process. So naturally, you would expect those numbers to be a little bit higher. So the only reason I point this out is to take it seriously, one, when you're preparing for this exam, and two, don't set yourself up for failure and in the mindset of total catastrophe if you don't pass the exam the first time. Okay? 4 out of 10 people are going to fail this exam when they take it. And there's a lot of really smart people that take it and don't pass. I've heard from a lot of those people. Okay? So don't be absolutely terrified if you don't pass. All right? Now, with that said, we want to take it seriously. We want to do the best we can so we have the best chance to pass the first time. But don't be devastated if you don't pass that first time. About the exam, 175 questions, multiple choice, and 4 answers are given, and only 1 is correct. So this is different from the NAPLEX, where you can have multiple answers that are correct, and you have to select multiple answers. So that does make things a little bit easier in knowing that 1 answer is correct. It's just 1. So that can make you rest a little bit easier. But the questions are challenging for sure. But there are some gimmies as well. Generic names, that's important to remember. I get asked that question a lot. Is it brand or generic names on the exam? It is typically standardly going to be generic names. So if you know a lot of drugs by brand name and can't remember generics, that's something you're probably going to have to work to beef up on. And then, of course, look at the content outline. And I'm going to describe these a little bit more in detail coming up here. So the first section and the biggest section that I'm going to start with is pharmacotherapy. This is 65% of the exam, or approximately 114 questions out of those 175. I tell people to focus on weaknesses. This is a big, broad exam. If you're an expert in anticoagulation, if you're an expert in diabetes, and those are the types of patients you work with every day, I wouldn't spend much time studying those areas. I truly, truly wouldn't. Now, that might not make you a better clinician in what you do in your day-to-day life. I realize that. But you're not going to be able to pass the exam if you don't take a broad view here. And also I would focus on areas that have a lot of medications and areas that are really, really common that you may not know as well. So if you're not good in diabetes, maybe you work in other areas. If you're not good in asthma, COPD, depression, pain management, focus on those big, broad areas that you know you're weaker in. I wouldn't focus on highly specialized areas, thrombocytopenia, multiple sclerosis, those areas that are really, really specialized. I wouldn't put a heavy focus on those areas. Two simple concepts as far as addressing some of these pharmacotherapy questions when you're taking the exam. To simplify it, understand why you would select a medication and understand why you wouldn't select a medication. So, medication selection, we're thinking of guidelines, best practices, why you wouldn't select a medication if you've got a contraindication, something like that. And I'll go through that a little bit more detail here. So be prepared to have case scenarios presented to you and understand why we would select a drug or not select a drug. So contraindications, warnings, compelling indications, guidelines, major and adverse, unique adverse effect profiles. Monitoring parameters is a good one to make sure you understand kind of with each drug or drug class. Major drug interactions and genetic considerations is a growing aspect of these board certification exams and pharmacotherapy as well. So think about your allopurinol, carbamazepine, abacavir, kind of a few common examples where genetic testing might be involved or there might be genetic variations that we should avoid these medications in. Dosing. I get asked about dosing a lot. Do I have to memorize doses? So let's pick a random drug, labetalol. Would I worry about memorizing the max dose of labetalol? No, I wouldn't. Are they going to ask you about, what the max dose of labetalol is? Probably not. There's nothing saying they can't ask you about that, but that is definitely not what I would focus on. With that said, if you've got a drug that has a boxed warning for maybe elderly patients and going above a certain max dose, that might be something good to take note of. If you've got specialized things, understanding dosing in different disease states. So say in atrial fibrillation, maybe we've got different dosing in DVT prophylaxis if you're using a DOAC or something. So thinking about some of those exceptions, dosing warfarin's one, I would think about trying to memorize. How much do you increase, percentages, things like that. So obviously we've got that all laid out in our study materials and that sort of thing. Some of the antibiotics, I think of aminoglycosides and understanding the pharmacokinetics, peak and trough, and what you might do to adjust dosing there. I think that's an important thing to kind of memorize and think about as well, because that's something we do frequently as pharmacists. So again, don't put a heavy focus on, max doses and kind of things like that. But if there's kind of unique things associated with the dosing, then you might want to take a little time and learn that. Okay, moving on. This is probably the most important slide I would teach you. It is, people still get caught off guard by this. The way I sum it up is, if I said you have to take the BCPS exam tomorrow, you haven't studied at all, and you had, 10 to 24 hours to prepare, I would tell you to probably spend most of that time studying statistics, okay? If you know statistics well, a lot of the questions are going to be pretty straightforward. There's not going to be a lot of gotchas, that type of thing in this section. Okay, so if you can do really, really well on this statistics section, I think it's going to really bolster your chances of passing. I'm not going to say it's a guarantee, but I will say if you don't study statistics and you're not good at statistics and you go in there and take that exam, I would say it's pretty close to a guarantee that you're not going to pass the BCPS exam. Okay, and I'm biased, but I've had a lot of great comments and great feedback on some of our statistics and regulatory content, because I think we do a great job of simplifying it, but giving you enough information, obviously, to help you prepare and pass the exam. So that's, I think, one of the things that we do a really good job at, is simplifying biostatistics in our study materials. So thinking about statistics, just some examples, and this isn't definitely an all-inclusive list, but statistical tests, p-values, power data interpretation, some calculations like NNT and ARR. So if you have no idea what I'm talking about with some of those things, then you definitely need to beef up your studying and study statistics for sure. Okay, so again, very, very important, very, very critical to your success in passing this exam is statistics. One other thing that has come through in the BCPS content outline, and again, I encourage you, go look at that content outline after you're done watching this video, and go through the list of things. And we've done that in our study materials. We've done that kind of work for you in putting together our content. But with that said, if you're not using our content, using somebody else's, be sure you look at that content outline. Really, really important. So some other things that have come through, thinking about level of evidence in clinical literature, kind of, case studies versus randomized controlled trials, and some of that stuff's important. Teaching strategies, education, that's important on a patient level, but also as a pharmacotherapy specialist. You're probably going to be giving presentations, and that's going to be to various groups, whether it's nurses, patients, physicians, other pharmacists, and really understanding some of the teaching processes that go involved there as well. You certainly can be tested on that, as it is in the content outline. Then lastly, this has kind of classically been referred to as the regulatory section. They've changed the name over the years, as I've followed this for about probably 8 to 10 years now. This is 10% of the exam, so 17 questions. So in my mind, that is a significant chunk. And again, I think we do a great job of statistics and regulatory, spelling out some of these things and giving them to you in an easy to understand method there. So some example things that show up here: MUE, or medication use evaluations, ADR reporting, P&T committee formularies, vaccinations, population health, quality metric standards. Certainly we're going to think about joint commission in things like that, drug approval process, where and when we look at that drug approval process, and how our role as a pharmacist is involved in that process, and the education surrounding that. So regulatory, definitely something that you want to think about, and again, I think we do a great job of kind of summarizing that in a quick, brief way, but also an easy way to understand, and providing content that's relevant for your exam. So lastly, just kind of summing up here, our study materials, 25 plus hours of video review course. We do update that annually. So just here in late 2021, we updated over 20 videos just based upon guidelines, new drugs that come out, things that are going to be relevant in your preparation. I do get the question a lot. So let's say you have your exam in April or May, which is the usual time frame. You have that exam coming up, and the guidelines change 2 weeks before your exam. I wouldn't anticipate that being on your exam, okay? I would say 3 to 6 months out. I mean, they have to set the exam, right? And so I would say 3 to 6 months out and in towards your exam, I wouldn't anticipate being tested on that content. With that said, it might be good to look at it, that type of thing, but in a way you kind of don't want to confuse yourself either, but you want to be relevant in your practice too, if it's something that's practice changing for you in educating patients or whatever job you do. Obviously, it's something you're going to look at and potentially know, but you're probably going to know the old guidelines very, very well if it's something you work with frequently as well, too. So, again, new guidelines that just come out right before your exam. Bottom line, I wouldn't worry about them a ton. Other perks to our All Access Pass online question bank. We've got 2 downloadable PDFs on our practice exams. So this will give you the opportunity to time yourself. I've received definitely a few emails of people who have not finished their exam. And this is why I strongly encourage practice questions, okay? So you should be doing questions in a minute or less. That's kind of the target that I recommend you set. That gives you time to review. That gives you time to also take a little bit more time with a question, like if you get stuck on something. But you really need to set a pace and think about these questions from a timing standpoint, because you do not get penalized for answering questions incorrectly. So you got to make sure you get through all the questions. You will be penalized. You will get questions wrong if you don't get to them. Okay? Really, really important that you work on that. And obviously we have that opportunity to do that with our practice questions, our question bank, as well as the 2 full-length practice exams. Then our statistics, I talked about that quite a bit already. And regulatory, I think we do a great job. I got some comparison tables as well. Our main packages are the 1 year and 6 month All Access Pass. That's definitely going to be your best value. You get the most content there. With that said, we do have question bank only option. So we got 1 and 3 month access. So if you choose other study materials, you want to go through ACCP or whatever, we do have the availability to get practice questions. And just that section, it'll save you in the ballpark of probably $30 to maybe up to $100, depending upon kind of which all access pass you're looking at versus which question bank package you're looking at too there. So included in that are those 1,000+ online questions, as well as the 175, the 275 or full length practice exams. So I hope that helps give you a little summary of the BCPS exam. I do independent consulting, so you can track me down if you're interested in that. I've had a lot of kind people reach out with words of encouragement, obviously, and that I've helped them pass their exams. So it's definitely something I'm pretty proud of. So you can see some of the testimonials here, comparing us to other content and that sort of thing. So again, I think we do a great job of simplifying things for you and making sure you understand the important aspects of drug selection in the pharmacotherapy section, and then the other sections of statistics and regulatory. And then if you're looking at our content, of course, meded101.com/store has links to everything. If you happen to be thinking about another board certification, BCGP, ambulatory care, we've got content there as well. And then, of course, our BCPS. So click on the appropriate exam that you're looking at meded101.com/store. If you've got comments, questions, suggestions, you can email me. If you want a certain video about the BCPS exam, or you've got a question on application process, that type of thing, I do try to respond to as many as I get. I do get quite a few. I do help other pharmacists kind of set up a game plan, and I do sit down one-on-one with folks for a cost to set up kind of one-on-one and get that game plan figured out with how best to prepare based upon your background and your experiences and some of that. So I've certainly done that with some folks as well, but certainly understand cost, particularly if you've recently graduated or have a lot of student loans, that type of thing. I certainly understand cost is sometimes an issue for folks as well. So again, reach out to me, mededucation101@gmail.com. If you enjoy our podcast, reallifepharmacology.com, if you enjoy the blog at meded101.com, you're probably going to utilize and benefit and enjoy our content for the BCPS exam. So with that, leave a comment below, drop me an email, and thank you for taking the time to listening, and I wish you nothing but the best in your preparation on the BCPS exam.